Hello. Hello. Dr. Matthews, sir. Hello. Dr. Matthews, sir. Shall we start?
Yes. Shall we?
Yes. Thank you, sir. Very good afternoon. Namaste, everyone. Welcome back to our 105th webinar session in this weekly webinar series, Gyan Ganga, a knowledge voyage. First of all, I would like to extend a warm welcome to our respected dignitaries, respected governing body members, respected Gurujans, our today's respected guest speaker, Dr. Matthew Joseph Vempilli, sir. Our scholars, students, and all the Facebook and YouTube live viewers. I welcome you all in today's 105th session in this series. Before proceeding further, I would like to pay our heartfelt gratitude to our mentors, respected Padma Bhushan Vaidyashi Devinder Trigunaji, President of Governing Body RAV, respected Vaidyashi Manoj Nesiji, Advisor Ayurveda, Ministry of Ayush, for their constant direction, encouragement, and great motivation in sustaining this series successfully. Their inspiration is catalyzing to our efforts. Now, today in 105th session, we have with us as a guest speaker our esteemed CRAV Guru from Kerala, respected Dr. Matthews Joseph Vempilli, sir. Sir is a founder and chief consultant at Vempilli Ayurveda Hospital, Nagapuza, Kerala, and has expertise in Asti Marma Chikitsa since generations. And today he would be sharing great insights and information on an approach to sports injuries with reference to repetitive strain. Post session, there will be a question and answer session. You can ask your doubts or queries at that time. Now, with brief introduction of our today's guest speaker, we will start the session. Dr. Matthew Joseph Vempilli, sir, is our esteemed CRAV Guru from Kerala. He is also serving as founder and chief consultant at Vempilli Ayurveda Hospital, Nagapuza, Kerala, a 25-bedded orthopedic hospital, utilizing relevant modern diagnostic tools and integrated biomedical concepts to improve the standards of Ayurvedic treatment protocols without compromising the basic principle of Ayurvedic science. He is continuing a strong legacy in Marma Chikitsa since last 4 generation. Sir is MD in Shalya Tantra Marma from Government Ayurveda College, Trivandrum. Previously, Sir has served as Chief Medical Officer Specialist in Marma at Department of ISM and offered services at District Ayurveda Hospital at Kottayam, Kasargod, Alappuzha and Thodapuza as well. Sir has offered services to Kerala Ayurved Limited for establishing their head office hospital at Aluva and offered in-house training to more than 100 house surgeons under Marma section. He served as faculty in various workshops and seminars conducted by district committees of AMAI, ISM, IMG Cochin, CCRS, Government Ayurved College, Tripunithara and many more. He took initiative in establishing anorectal clinic at Government Ayurveda Hospital, Thodu Puza. He has also worked as convener of Sports Ayurveda Research Cell, that is SARC, Thoda Puza, to popularize the Ayurveda among sports persons. He has treated a number of national and international sports stars and helped them in achieving their goals. He has modified traditional Agni Shalaka to more handy and user-friendly one. Sir is also recipient of Bishop Pratibha Award for Sharp Zone Award, and he has been selected as expert person in IMR project in 2018, and he has contributed in documentation of effective Marma practices CCRS, and also presented various papers on various topics like Marma, sports injury, and Agni Karma. Now, I would like to request Dr. Matthew Joseph, sir, to please start off with his deliberation, and with a request to all the viewers to please keep their mics and camera off to get a better connectivity. Over to you, sir, and welcome.
Yeah. I'm audible. Am I audible, madam?
Yes, yes, sir.
Yeah, yeah. So, is it okay? Right.
Please share your PPT, sir.
Yeah.
Yes.
Am I
Yes,
audible?
yes.
Yeah.
Yes.
Yeah.
PPT is also very visible, sir. Please continue.
Good afternoon, one and all the members of RAV, especially respected Vaidya Devendra Trigunaji, Manoj Tesri, Advaita Rayu, and all other officials of RAV, and respected senior guru of RAV, and all other Shishya. So, I'm starting. My subject is repetitive strain injuries diagnosis and management. See, before going into the subject, a few words regarding how I came to the field of sports injury management. So, after completing my PG in Shalyatantra from Government Ayurveda College, Trivandrum, I started my career as a specialist medical officer in the Department of ISM, Kerala. And I was working in district hospitals as a specialist medical officer to treat conservative orthopedic conditions. That was the post given by the Department of Indian System of Medicine as medical officer Marma. In my native place, I worked for 15 years, right from 2000 to 2015. During that period of my practice, my patients almost, uh, especially as I was in a practice of Marma Chikitsa, orthopedic cases were coming and we were treating it as conservatively. And among the cases, a number of patients were there from sports-related various injuries and its rehabilitation conditions. As my town was very familiar with so many sports schools, a lot of students from the school level and the college level, they were all coming from for various small injuries and its rehabilitation. So I was very interested to learn more about the sports medicine and its management through Ayurveda. So at the in the year 2011, I had a situation to treat an athlete who was preparing for the Commonwealth game at that time. He was preparing for the 800 meters race. And he came to my town, and as a part of high altitude training, he went to Munnar, and there he had a small injury to his calcaneal tendon. Tendocalcaneal injury was there. Due to so many factors, as his practice was not steady, and he had severe pain and swelling of that tendocalcaneal. And there was only very limited time. And these were the 5 factors the athlete was anxious about. He has to manage the pain, the minimum period of treatment, only 5 days to go for the Commonwealth game. And he was a very good athlete, and he was expecting a medal at that event, and high expectation was there from the patient. And before going to the event, he needs rehabilitation. And at that time, the doping problem was there was a very scandal about the doping issues, and no scope for any internal medicine, even Ayurvedic medicine. So this was the situation. The patient came to my hospital and claimed these 5 things. So at that time, by the grace of God, Vagbhada Sutra was coming to my mind. Snayu Sandhi Sira Prate Sneha Daha Upana. This was implemented for that patient, and we did a dhara with the Dhanyamla, followed by Upanaha and an Agnikarma within the minimum 3 days of time. And the 4th day, he went for a normal warm-up and normal rehab exercises. And the 5th day, he went to the event. And the result was very good. And he is none other than Sajish Joseph. He outbeated Manjeet Singh and won the 800 meters with gold medal. And in the next coming Federation Cup also, he won the gold medal, and that was a very promising result as far as sports Ayurveda was concerned. And after this event, right from the 2011 to 2016 period, in the district hospital where I was practicing, I was able to treat almost around 6,000 athletes from school level, college level, national level as outpatients, and also around 1,800 as inpatients also. So these are the two international athletes at that time came to me for the treatment, and that was a very good experience for me, and that's how I entered into the field of sports medicine. So at that time, this was a statistical, or even though it is not absolutely right thing, this was the absolute statistical presentation of the different categories of sports injuries, and they reported in our hospital. And most of them, 60% was from athletics. And again, coming to the subject, repeated strain injuries. As you all know that trauma, we have three branches, three sections of trauma. One is direct injuries. You know that from the slide itself, you know that when a person is falling, there will be a direct injury to the concerned part. Next one is indirect trauma. For example, fall on an outstretched hand resulting in a fracture of a clavicle or something like that. And third one is none other than repetitive strain injuries. And here the picture is very, very self-explanatory. Sports persons are subjected to repeated strain injuries. This is our little master who is batting with his heavy bat. And as you all know that as a result of his practice and long career, he also had a problem of lateral epicondylitis, which we call it as tennis elbow, which was very familiar after his name. So, right from which are the structures involved in a repetitive strain injuries? Right from skin to bone or bone to skin, these are the possibilities. At the level of his skin, it can be a blister. At the level of a bursa, it can be a bursitis. At the level of muscle tears or muscle area, tendon, tendinitis, it can be a rupture, enthesopathies, ligament, a strain or instability, joint, synovitis or a capsulitis. At the level of bone, it can be a stress fracture. So these are the structural, right from skin to bone, these are the structures involved in repetitive strain injuries, especially in the sports field. So these are the mechanisms which the sports person are subjected to during their practice or event or calm down or whatever in his career. These are the possibilities. Too much, too quickly, too heavy, inadequate warm up, poor equipment, incorrect surface, poor technique, mechanical imbalance, previous injury which is not healed and going to again for the event or practice, poor healing, and which you can consider in another way, fast repeated movements. See, as you all know that suppose a person who is batting, he is giving repeated extension of his elbow. Likewise, every sports event requires repeated movements of either his upper limb or lower limb areas, which gives load to the joint or concerned muscle or ligament or any structures of the musculoskeletal system. Excessive load will be there. So, and again, inadequate training. Especially the Indian athletes, they are not properly trained before going to the events due to so many factors, and unsuitable tools or components. They are not using the proper security measures. Poor workplace design. As you all know that every part of our country is not having a very good designed and synthetic tracks are not available in everywhere. So there is chance for recurrent sprains or muscle injuries where they practice in a not a very good workplace. Poor job design, poor posture or support. And as you all know that the cold, adverse climatic situations like damp, cold surroundings, such like that one. And also, and finally, outside stresses. Sports persons are subjected to severe stress, from outside as well as inside, right? So this is what is happening in repetitive strain injury. Most of the injuries are obvious and direct. Those due to overuse, we call it as an alternative to repetitive strain. Overuse injuries also is another type. They are mainly seen in athletes. That's why the unfortunate term sporting injuries. Dancers and may occur anyone after overactivity without adequate training. Anyone who is subjected to overactivity without proper warm-up or practice, they can go for too much. This is the process, too much, too soon, too fast. That will create overuse injury. So what will happen? Pain and inflammation in the soft tissue components of the locomotor system, like tendon, ligaments, capsule, fascia, etc., are common in all age groups as representing uh, major areas where repeated strain injuries are subjected. Commonest RSI. To each tissue, for example, for muscle injuries, extrinsic as well as intrinsic lesions can be there. Extrinsic lesion means common in contact sports and many cause severe muscle bruising and periosteal damage. For example, anterior thigh is the commonest site. Intrinsic lesion often occur at musculotendinous junctions. Example, hamstring tears usually associated with the herniation. Tendon. As far as tendon is concerned, there can be a complete or a partial tear. For example, Achilles tendon, 2 to 3 centimeter from calcaneum above. There can be tendinitis, inflammation of structures around a tendon result from overuse, perhaps combined with the local pressure. Picar veins is an example. Enthesopathies, tendo-periosteal junctions are more usually damaged due overuse. For example, tennis elbow, plantar fasciitis, etc. Ligaments. Ligament damage is always as a result of sudden trauma. As you all know that it takes longer time to heal than fracture of a related bone. It takes more time and it's very painful and it needs more care and attention. For example, medial collateral ligament of knee. And of course, as a joint, there can be a synovitis. The usual site is knee joint. The capsulitis, usual site, a shoulder joint. And at the level of this bone, there can be stress fractures. These are the usual sites where stress fractures are coming. Metatarsals, lower tibia and fibula, femoral neck, and pubic rami. And let me come to some common situations, very commonly occurring repeated strain injuries, clinical conditions. The first one is carpal tunnel syndrome. So as you all know that the median nerve is passing through the that carpal tunnel, which is getting entrapped as a result of inflammation, as a result of repeated strain, which results in the abnormal sensation of the median nerve compartment area, which is basically the middle finger area, the index and the thumb, getting numb or a neurological deficit in the acute situation. So that is pain and tingling of numb fingers, especially the thumb, index and middle fingers. Pain increases in the night, especially in the chronic situations, thenar or hypothenar muscle weakness will be there. Chronicity leads to neurological overlay. And the differential diagnostic point is cervical spondylosis, and EMG is the confirmatory test. And of course, as I shown you in the initial slide itself, the lateral epicondylitis, which we call it as tennis elbow, which is a non-specific inflammation of lateral epicondyle, commonly known as tennis elbow, is pain on the lateral epicondyle of the humerus, where extensor group of muscles of forearm is attached. So repeated strain, extension of the forearm, which results in a strain of the lateral epicondyle, which results in a non-specific inflammation, which we call it as a lateral epicondylitis or tennis elbow. Symptoms: pain aggravates on forceful extension of wrist against resistance. Local tenderness at lateral epicondyle. The differential diagnostic point is C7 neuropathy right from cervical spine. And that's just reverse is a medial epicondylitis, which we call it as a golfer's elbow. Medial epicondylitis report as golfing, bowlers, chess, weightlifting, and throwing sports. Symptom is pain over the medial epicondyle of the elbow. Site of the pain is from the origin, wrist flexors and pronate forearm, pronators of the forearm. Resisted wrist flexion, forearm pronation aggravates pain. Chronicity leads to ulnar neuritis. And regarding the shoulder joint is concerned, rotator cuff injuries are very, very common in cricketers, basketballers, volleyballers, like that one. And these are the rotator cuff strain injury conditions: supraspinatus tendinitis, infraspinatus, teres minor, and subscapular tendinitis. The related conditions of the shoulder are bicipital tendinitis, subacromial bursitis, subcoracoid bursitis, and in chronic condition, even if not treated, leads to periarthritis and frozen shoulder finally. And iliotibial band syndrome, which is very, very commonly seen in hurdlers, walkers, cycling, and like that events, it is very, very common. You can see from the slide, ITB runs the length of the thigh. The IT band is a thick band of fascia on the lateral aspect of the knee, extending from the outside of the pelvis over the hip and knee. So it can create pressure on the site of the IT band insertion, which results in pain. Sharp or burning pain just above the outer part of the knee, pain that worsens with continuous running or other repetitive activities, swelling over the outside of the knee, pain during early knee bending. These are the features. So differential diagnostic points: patellofemoral syndrome, chondromalacia patella, and lateral collateral ligament tear. These things you have to exclude. And jumper's knee, which we call it as patellar tendinitis. It is very, very commonly seen in jumping items like high jump, long jump, basketball, volleyballers. And injury to the patellar tendon leads to the pain and inflammation. Jumper's knee commonly occurs in athletes who are involved in jumping sports such as basketball, volleyball, but can affect any athlete. And here the differential diagnostic point is Schlatter's disease or Osgood-Schlatter's disease, which is seen in adolescent period due to overpressure of the quadriceps. The tibial tubercle is getting avulsed. That condition you have to differentiate from patellar tendinitis. The next point is shin splint. Here we can see our powerful players, basketball, tennis, and football. They are subjected to repeated strain to the shin, which gets defined as pain along the inner edge of the tibia. Shin splints are usually caused by repeated trauma to the muscle tissue surrounding the tibia. Biomechanically, overpronation is a common factor in shin splint, seen more in runners and jumpers. And the next one is retrocalcaneal bursitis. See, walkers, hurdlers, running, racing items. These athletes are subjected to repeated strain to that tendocalcaneum, and pain and swelling of retrocalcanearia bursa situated between tendon and calcaneum, seen as a bulging on either side of the tendon. Here we have to differentiate it from Achilles tendinitis. Achilles tendinitis you have to differentiate from bursitis. And finally, the Marx fracture, which is called the second metatarsal fracture. Fatigue fracture usually of the second metatarsal neck or shaft. So called because its frequency in army and recruits. Usually not detected in acute phase. Later X-ray, if you are getting a digital X-ray, it will be available in even after 5 or 6 days only. And differential diagnostic point is metatarsalgia. And in acute phase, you may not get in X-rays. At that time, a CT will be very diagnostic. So these are the commonly occurring some conditions to the athletes, right from carpal tunnel syndrome to Mars fracture. And regarding the pathology in general, how this repeated strain is working and finally result in an inflammation or a pain or a bursitis or a fracture. This is the three main causes of overuse. Trauma will result in one, friction. A tendon or bursa may, during joint movement, be subjected to excessive friction within a fibrous sheath or over bony prominence. So that is the main point, friction. Next point is stress, repeated or unguarded stress. This is very important. Unguarded stress. It's not a guarded. Unguarded stress may result in tears of muscle or tendon. Fibers, fracture, articular cartilage lesions, etc. are examples for direct unguarded stress. And finally, the pathological thing is ischemia. Ischemia can be relative or absolute. Ischemia may be relative, arising only when excessive activity makes demands on blood supply which cannot be met, or absolute when intramuscular edema causes swelling. So it can be a relative ischemia or an absolute ischemia. So, diagnosis of these conditions. An accurate diagnosis depends on taking careful history, which is very lacking nowadays in clinical practice. So, accurate diagnosis basically depends on the case taking itself. So, an history is very important. How the athlete is happened to injure his knee or a tendon, or how the thing was happened. And you have to get a proper history. And examination is equally or more important. Considering the history, examination requires some knowledge of anatomy, basic anatomy and physiology of soft tissues such as joint, muscle, tendon, capsule, etc. So anatomical understanding is very important, and examination is equally important. And soft tissue lesions may be a part of generalized disease requiring further investigations. So that is a very important thing. Soft tissue may be a prodromal stage of generalized diseases like arthritis or something like that. So you have to rule out all these conditions like polymyalgia rheumatica, early phase of RA, SLE, other inflammatory arthritis, viral bacterial infections, generalized osteoarthritic conditions, endocrine diseases, osteomalacia, Paget's disease, malignancy, akinetic phase of Parkinsonism, fibrositis, and psychogenic rheumatism, which leads to malingering. So these things you have to rule out when you focus on direct examination, and rule out the possibility of a systemic diseases. Laboratory and advanced investigations are usually unnecessary for most of the local lesions to diagnose epicondylitis. If you are getting a proper history and local examination, specific tests, and then you can very easily diagnose the condition. So examination and history taking are very important. Advanced investigations are not at all necessary in so many conditions. The basic investigation like X-ray will be very sufficient for diagnosing to rule out bony lesions or advanced conditions. Very rarely CT and MRI are essential to rule out anterior cruciate ligament injury and its level, or like that one only. Stress fracture diagnosis may be suggested by sport tenderness, painful ultrasound test, and CT is the diagnostic final word for stress fractures. And regarding the treatment, as a general protocol for the sports injuries, treatment should start immediately. Any delay which often means that the optimum time has passed. Treatment within 48 hours and treatment after 48 hours. As a general guideline, treatment before 48 hours, it rises, and it is modified as prison. Prevention also is a factor, prevention. And next one is rest. And the second one is ice packs, applied over 10 minutes, not too much, not directly, with the help of a towel covering. not directly giving a scald or a frostbite. Compression with an elastic bandage 20 centimeter above and below the injury helps to control the bleeding. Elevation. And finally, non-steroidal anti-inflammatory drugs. This is the protocol of a sports injury within 48 hours. And after 48 hours, the role of heat is coming. Heat therapies are very relevant. Heat helps to control pain and muscle spasm, promotes healing by increasing the vascularity, hot packs, shortwave, ultrasound like that. And finally, physiotherapy like exercise programs, mobilizing, strengthening, stretching. All these are relevant in the later stages. And swimming is an excellent protocol as far as most of the athletes are concerned, especially the runners, athletes. Like swimming is an excellent strength and stamina improving program. So this is the general protocol of the sports medicine. And next one. So so far we have covered the sports injuries in general, some selected conditions and its general principles of management. And as far as Ayurvedic concepts related to repeated strain injuries, I shall describe in a very short way. So as you all know that Marmabhigada Samanya Lakshanas are mentioned in our Samhidas. I have taken this from Vagbhada, Mamsamarma, Astimarma, Siramarma, Snayumarma, Sandhimarma. These are the general Marmabhigada Samanya Lakshanas. If a Mamsamarma is involved, bleeding, pallor, reduced sensory perception, intense pain. Astimarma, painful discharge from blood, viscous fluids. Siramarma, profuse bleeding, excessive thirst, dyspnea, stupor, hiccup. Snayumarma, tremor, stiffness, severe pain, and disabilities. And Sandhimarma, intense pain, limping, reduced range of movement, reduced power, reduced muscle bulk, and swelling. It is a very, very typical lexana of Sandhimarma Darshana. Vastu Shugairiva Akirnam. Rude Chakuni Khanjada, Bela Cheshta Cheha, Parvasofascha Sandhije. Like that, the Sandhi Marma with the Lakshana is mentioned in Vagbhada. So this is very classically mentioned in our text, and we have to find out the Lakshanas, which Marma is involved, and the Lakshanas, and correlate like that one, and finally coming to the next phase of the treatment. As far as the concept of Ayurvedic etiopathogenesis regarding repetitive strain injuries, Abhigadam, Abhigada Vishesham, this is Abhigada Vishesham itself is there, and Vada is vitiated. Secondary Rakta Pitta involvement along with the Kapha, Sthana Samsraya and Mamsa Asti Siras Nayu Sandhi, which leads to Marmabhigada. This is a postulation only. I don't know whether everybody is agreeing with my etiopathogenesis concept. Anyway, this was my concept regarding repeated strain injury in Ayurvedic way. And I have arrived at 4 conclusions how to treat repetitive strain injury conditions according to Ayurvedic fundamental theoretical concept. The line of treatment was derived according to derived by 4 basic Chikitsa sutras. One is Marma Bhigada Chikitsa. Second one is Uttana Vadarakta Chikitsa. Third one is Bhagna Chikitsa. And fourth one is, as I told you in the initial phase itself, this is very, very important and relevant, and it was very clinically significant also. Snayu Sandhigata Vada Chikitsa. So, these 4 lines are very, very important as far as when you treat repetitive strain injuries. In stress fractures, you can consider Bhagna Chikitsa itself, Bhagna Chikitsa principle itself, and muscle injury to an extent. Snayu Sandhigata Vada Chikitsa, you can see in when you are treating a bursitis or a tendinitis or a ligament injury, you can consider Snayu Sandhigata Vada Chikitsa. Uttana Vada Rakta Chikitsa, in most of the conditions, swelling and associated effusion like that will be there. So, and Uttana Vada Rakta pathology is running in that area. And finally, Marma Bhigada Chikitsa, even though it is not classically mentioned in the Samhidas, according to local available traditional authors, Marmabhigada Chigilsa is mentioned in various texts in Tamil as well as in Malayalam textbooks. So you can treat Marmabhigada according to specificity of Marmabhigada Lakshana and its duration and its pathological status. So Marmabhigada Chigilsa is not a well-defined thing just like Uttanavadarakta or Bhagna Chigilsa or Snayu Sandhigata Chigilsa. So Marmabhigada Chigilsa is yet to be classified and it should be more explained with the clarity of a traditional protocol. And Marmabhigada Chigilsa, it is highly specific according to the etiopathogen factors. Specific Marma stimulation techniques are there. It is different from school to school. In South Kerala, it is something different. North Kerala, something different techniques are available. In Tamil Siddha Marma system, different tools are also, different methodologies available. So you cannot claim that one school is right or one school is wrong. You can take whatever is clinically helpful. All the schools are relevant and added. You can correlate each one and use the related and the most suitable technique for Marmabhigada stimulation techniques. Different types of bandaging. This is very classically in our text itself. We have different types of bandaging, right from Kosas, Sostiga, Muttoli, China, Dama, Anuvelidam, like that one. Different types of bandagings are mentioned in our classical text. This is being used in various conditions of sports injuries, especially repeated strain injuries. And Lepas, Kshiradhara, Tailadhara, Pichu, local application of oil, Tailadhara, Kshiradhara, prepared with specific drugs according to the clinical symptoms. We are using Kshiradhara, Tailadhara, Pichu, Lepa, different types of bandaging and techniques. And next one is Uttana Vadarakta Chikitsa. It is classically, it is Vadarakta Chikitsa and Uttanam, Lepanam, Abhyangam, Parishegam, Avagam. So that is very, very important. So with different pharmacological preparations, you can give Lepa, Abhyanga, Parishega, and Avagaha. Apart from the above set classical line of management, the following modalities are also found clinically useful. Udabag Lepas, Marma Lepas, which is classically which is being used in Kerala and Tamil Nadu. Different types of Marma Lepas are available and which is to be studied in detail in the coming years. Ushma Sweda, pressure bandages, Jaluga Avjarana, and even Agnikarma is also useful in selected conditions of repeated strain injury to prevent further recurrence as well as pain management. Okay. And Bhagna Chikitsa, it is clearly mentioned in our Susruta Samhita, reduction, immobilization, rehabilitation. The very same thing we are also following. Reduction if necessary, immobilization if necessary, rehabilitation always necessary. So these are the classical textual interpretations of management of repetitive strain injuries. And again, and finally, I forgot. The final thing is Snayu Sandhigata Vada Chikitsa, Snayu Sandhi Sira Prapte Sneha Daha Upna, which was a eye opener to me to treat a sports person of national level in the initial phase, and he was getting a very good result. So I'm always remember this sloka, and it is very, very important to treat a sports person. And of course, to prevent sports injuries, the role of Dinacharya, role of Ritacharya and yoga is very, very relevant. Those who are doing these things promptly, they are they are not getting recurrent injuries. I have experienced from my clinical experience of last 10 years. Those who are following the dinacharya, those who are following the ritujariya, those who are doing yoga as a part, they are not subjected to recurrent injuries as a person not following these things. Okay. And the types of injuries, including fitness improvement program reported during my clinical practice of 10-15 years, this was the result. This was an absolute statistical representation of injuries. And the result was, of course, we had a very good clinical response of 60 to 65%, and recurrence was there. And of course, athletes will go without proper healing. They go to second event, third event, like that one. They go for recurrence. That is very, very frequently seen in sports injuries. And satisfactory result was 10%. And again, there were cases which we had to send for higher centers for surgical correction, just like complete ACL tear, like that one, with instability, like that one. So this was the result of the treatment of that period, right? So this is my conclusion regarding overuse injuries. Overuse and elusive injuries are elusive and insidious, seen mainly in athletes. RSI, repeated strain injuries or overuse injuries, can manifest from skin to bone. Diagnosis depends on taking careful history and thorough physical examination. Advanced investigations are usually unnecessary for most of the local lesions. Treatment should start immediately, a delay which often means that the optimum time has passed. Ayurvedic management of RSI is derived from 4 classical textual interpretations: Marma Bhigada Chikitsa, Uttana Vada Rakta Chikitsa, Bhagna Chikitsa, and Snayu Sandhigada Vada Chikitsa. And Ayurvedic management of RSI should be a field of research and has tremendous scope in this area of development of sports and allied activities. And finally, sports medicine should be necessarily be included in postgraduate discipline in Ayurvedic studies for scientific exploration and clinical practice. And I am giving you some examples. In Kerala, we are treating Marma Bhigada with some selected, which is very predominantly pharmacologically potential drugs. I am just showing some slides, the relevant, some locally available plants. I don't know whether all the drugs are not getting the proper Sanskrit exact name. Anyway, I will be getting the scientific names. I will show it one by one. This is very useful, which with the help of the juice which we take from this plant, mixed with the specific powders to make lepas and even avagaham for preparing kashayam also. This is a very potential drug, getting anti-inflammatory action. The small variety of the very same plant is also very potential one. And as this is very popular all over India, Cisca dragularis, which is very good for healing fractures and ligament injuries. And this is a very locally available plant, which I, from my experience in ligament injuries and sustained recurrent muscle injuries, this plant was very, very useful as to prepare labas, to prepare for potalis, and prepare for kashayam, to prepare for so many other related pharmaceutical combinations. This drug was very, very powerful, and it is a very, very useful plant. And it is a very good anti-inflammatory and pain management. And it's a variety of strictness, the basic plant strictness. It is very, it's a very climber like that one. It is very useful in the management of pain, which is used for making kashaya for avagaham and local dhara like that. And of course, it's an ingredient of a very familiar, very famous Kerala Murivanna. It's an ingredient. It is also very useful, and it is very useful in sports injury management. And it is an ingredient of Mustadi Marma Kashaya, which is given internally for healing of Marma Bigadas. It is a climber. It is seen in Kerala and Tamil Nadu, right? And this is another plant which is being used locally for making Upanaha, Leba, and Potalis. And of course, this is also a climber which is very widely seen in all over India. This cardiospermum helicabum, this is also being used in Marma practices. And of course, sports person, this is a very cheap and very useful thing for giving as an internal medicine as well as external. It is being used for the sports persons. It's a very useful thing. And this is none other than Murivanna, which is a oil preparation of Kerala, and especially the pharmacopoeia of Government Ayurveda College Trivandrum, most widely used formulation in Marma practice throughout the Kerala. It is being prepared locally by Vaidyas, and we are also preparing in our own small pharmacy, and it is available all over India nowadays. It is a very potential external application for the management of not only sports injuries, most of these orthopedic conditions. So, finally, I have a message to the young doctors. Please observe, learn, practice, develop skill, interact with the parallel medical schools, integrate relevant concepts in the field of physical medicine without compromising our basic concept. And team building with an attitude is the final word in victory. So, as a sports medicine practitioner, this was very relevant. A team building with an attitude, incorporating all the relevant concepts, it is very, very relevant in the management of sports medicine. And thank you once again for giving me an opportunity to present a small subject. I have a video also, if the authorities are permitting. I can show you a video regarding how the sports injury conditions are getting Agnikarma as a Anushastra in the management of sports injury management. So this, I'm thankful to the officials of CRIV, especially Madam Punam Dikshit and Ramakrishnan sir, and all the senior Gurujis and all these officials of RIV. I'm very grateful. And if there is a time, I can show you the video regarding how Agnikarma is being given in selected specific conditions of sports injury. Thank you.
Yes. Sir, are you sharing the video right now?
Yeah, I can show
Yes.
you if there is time.
Yes, yes. Okay, sir. Okay.
Speak. Madam is Okay, madam. Great.
Yes. Thank you very much, sir, for sharing
you.
very highly knowledgeable session with all of us today and covering all the aspects such as various drugs, Agni Karma, in the management of repetitive strain injuries. We must say it's a wonderful journey of sports medicine with great focus on its management without compromising the Ayurveda concepts as well. Thank you very much, sir. It was truly enlightening session this week. Now it's time for question and answer session. If anybody is having any question, they can please unmute and ask, or they can raise their hands as well. किसी भी तरह के सवाल है आप अनम्यूट करके पूछ सकते हैं या अपना हैंड रेज कर सकते हैं. Any questions from viewers? Anybody would like to ask anything? You can raise your hands as well. I'll convey the questions. Okay. Thank you very much, sir. Now we may conclude our today's session now. Thank you very much for truly enlightening session this week. Now it's time to extend a formal vote of thanks. I request Dr. Manisha Rana to please proceed. Over to you, Dr. Manisha.
All. This is Dr. Manisha Rana. It's an opportunity. It's a great opportunity for me to propose formal vote of thanks on 105th webinar of Gyan Ganga Knowledge Week, a webinar series organized by Rashtriya Ayurveda Vidyapith. On the behalf of organizing committee, I want to express my humble gratitude to the guest speaker of the day, Dr. Matthew Joseph, sir, for such a wonderful explanation on the topic, that is an opportunity to support an approach to support sports injuries with special reference to repetitive strains. Thank you so much, sir, for such a wonderful presentation, and especially the videos. You have really shared all of your experiences, all those years, what you have done. It was really a great thing to see. Thank you so much, sir, once again. Now I would like to thank wholeheartedly respected Vaidya Padma Bhushan Vaidya Shri Devendra Trigunaji sir, President, Governing Body, RAV, for his blessings and continuous encouragement. I also express humble gratitude to Vaidya Manoj Nesri ji sir, Advisor Ayurveda, Ministry of Ayush, for providing us his immense support and guidance. We are highly obliged to you, sir. I must thank the organizing team of RAV and the volunteers who work behind the scenes for their tremendous efforts to make this webinar a great success. I also thank all the respected gurus and participants who are connecting with us from continuously throughout the series in spite of their busy schedule. And thank you so much, all of you, for the patient listening. Topics and the speakers for the next webinar will be shared with all of you very soon. Thank you so much. Have a great day.
Thank you very much, sir.
Thank you, sir. Thank you.
Now participants can leave the meeting. Thank you and have a good day.